Now to a potential game changer for millions of Americans with food allergies. A medication originally used to treat asthma has now been FDA approved to reduce allergic reactions to multiple foods, among them peanuts and eggs. NBC News medical contributor Dr. Natalie Azar is here with more on that. Good to see you, Doc. This is a first of its kind drug. This is a big deal for a lot of families. Tell us about the medication and who specifically it's intended for.
You know, it might sound familiar to a lot of people. The medicine is called Xolair, as you said in the lead. It was actually approved about 20 years ago to treat asthma and treats a number of other allergic conditions. It's something that's called a monoclonal antibody. It binds this protein that's called IgE, and IgE is a trigger for allergic reactions. So who this medication was approved for, it's adults, adults and children 1 and up who have 1 or more food allergies. It's an injection under the skin that's given every 2 to 4 weeks, and it's for accidental exposure. And I think this is the key that I'd like for people to understand. It does not eliminate your allergy. What it does is decreases the likelihood that you're going to have a significant reaction to the allergen that you might be allergic to. And again, this does not eliminate the allergy. And I want to be very clear about the fact that it's not a treatment for anaphylaxis if you have an acute reaction.
But if you happen to come across some peanut dust or something like that in school, it could be life-saving.
Exactly.
It's based off of a new study. Tell us about that.
And this is exactly what the study was trying to look at. So they took about 168 people and they had them, you know, half of the group was taking the medicine, half the group was getting placebo. Of the individuals who received the medication Xolair, about 68% were able to tolerate the equivalent of about 2.5 peanuts without having a moderate or severe reaction. They also had a pretty good reaction also to cashews and wheat and milk. So it's not specific to peanuts. It's not specific to any particular allergen. It's more general, but very, very important. 17% had no change in the amount that they were able to tolerate. So again, it's not like you can immediately start exposing yourself to the food.
It's just such a different time, right? When you have your kids have their friends over. You even have to ask, like, the kids when they come over, their parents say, is there anything you're allergic to? We want to make sure if we're putting out snacks and the like. Are there any major side effects here, especially for young children?
Right. So the major side effects, as you can imagine, it's an injection. So it could be an injection site reaction, some fever, some joint pain, rash. Another highlighted point is that it actually can cause, just like any medication can cause anaphylaxis, which is a severe allergic reaction. And kids with allergies, people with allergies are a greater risk for that. So the first couple of shots are definitely administered in a healthcare provider's office so you can be observed. But this is a game changer, right? I mean, for all the parents and caregivers out there,
just a little bit.
Just knowing your child can go to school or go to camp, and if there's an accidental exposure that you're not always like sitting in fear and having that EpiPen at the ready, which you should still have, but still a little calmer these
Well, that's
days.
good news. We're glad you're sharing it with us, Dr. Azar. Thanks for being here. I know you.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.